Hi there, I'm Marcy Zwelling, Choice Care. I'm a physician here in Los Alamitos, California, and I'm here today speaking to a very wonderful and famous doctor who we're both meeting for the first time, so I'm just as excited as you. This is Dr. Prata. Dr. Prata is a world-famous medical demographer. She's a professor at UC Berkeley, and her specialty is reproductive health, in particularly the poor countries, but I would say we're going to talk about reproductive health throughout the world. Hello there, Dr. Prata. It's a pleasure to meet you. The first question I wanted to ask is, I know that you're from Angola, and I'd like for you to tell us a little bit about your upbringing and how you happened to come to this country.
Hi, it's very nice. Thank you for having me, Dr. Marcy Zwelling. As you mentioned, I'm originally from Angola. I moved to this country about 16 years ago. And I grew up mostly, I was born during the colonial time, so Angola was colonized by Portugal. And throughout my upbringing and adolescence and most of my adult life, I lived through a period of civil war in Angola, where sort of the parties that fought for independence were fighting each other in order to gain power. Nevertheless, I can say that I could consider myself privileged because I was living in the capital city, and that was never really, was indirectly affected by the war, but not really, with some exceptions. We didn't have bombardments and sort of a heavy fighting in the city.
Obviously, you got your medical degree in Angola then?
Yes, I did get my medical degree in Angola. So at the time, it was the only university that we had that had been established by the Portuguese, and that continued even throughout the period of the Civil War to have faculty from different countries around Europe that would come to teach us some classes. During a certain period of time, the most, when the Portuguese left and sort of the local parties took over, there was a period of stagnation where we actually didn't have school. But after that, there was quite a bit of support at the time from a lot of Eastern European countries and Cuba and other countries in Europe that sent teachers as trainers.
Fabulous. Well, let's get right to the meat of the subject, because I'm fascinated about reproductive health, and I want to know, for the first thing I think for our audience, we need for you to describe reproductive health. When you're teaching your students, how do you best describe the subject matter? What is reproductive health?
Well, the way to describe to the students reproductive health involves all of the knowledge, the processes, and the changes that we individuals go through, both physically, emotionally, but also socially, that is associated with puberty, adolescence, the beginning of our sexual life, childbearing, all the way up to menopause and after that.
Understood. So I guess what my question is, when you're studying reproductive health in the poor countries, basically I'm guessing that the goals of reproductive health in any country in the world would be the same, poor or rich. Am I correct?
Yes, the goals are the same. So basically that women, but also men and couples, in essence, have the necessary knowledge and tools to make healthy choices when it comes to reproductive health. So the goals are exactly the same, both in developing and developed countries.
So in this country, we would consider ourselves a developed nation, but nonetheless we have the same troubles, I think, as people do in other countries with respect to reproductive health and all kinds of health. And that leads me to my next question, because I think the basis of a lot of the problems that we have is lack of education just in general. People do not get educated. They don't understand their own bodies. They don't know what choices they might have. But education is mostly found in a culture where people are have an opportunity to go to school, where they are in a society where their family sends them to school. How do we work that out in these poorer countries where sometimes going to school means walking 50 miles away, where that kind of education is just not available?
Yes, that is a very important point that you're making. In a lot of poor countries, there's difficulties. I mean, there are different levels of problems related to education. There are social norms and economic circumstances that lead to parents to make very difficult decisions about who goes to school. And remember, we're talking about, in most circumstances, very large families. So the decisions are made: do we send the boys? Do we send the girls? Is it the first one? Is it the last born? So a lot of decisions, because schooling is extremely expensive. But it's something that can be dealt with if politicians, program planners, policymakers, sort of the leadership in those countries value education and prioritize educating its people as a very important sort of a resource for the development of the country, and do it in an equitable manner, so that both boys and girls have access, regardless, or at least to some education, regardless of the socioeconomic status of the parents or the place where they live. So when I talk about the place where they live, we're talking about people living in rural areas where, for example, you might have elementary school but not a secondary school. So then it makes it difficult for parents to make a decision to send the children to boarding school when they cannot afford. So then it cuts the education, especially for young women at 4 or 6 years of education.
You said that if you don't vote, you're discussing with the and now talking about how education is often how large families are in some countries. So how did you get your vote?
I think it's they're important links. Data shows that couples and women, when they are educated, they tend to have small families. We see that even in developed countries right now, and we see that in developing countries where women have access to education and where access to services are present. So women with more education tend to make better use of services, tend to have better access to information, and be able to then decide in the smaller families. Better education or higher education is also associated with the ability for women to stay in the labor force longer and be able to achieve career goals, and therefore that will limit the size of the family that they would like to have. So that by themselves also allow, by staying in the health force, will allow them to be able to contribute to increase the income of the family and be able to send the fewer children that they had to school.
And you make some very excellent points. But worldwide, while we're watching a global recession, even in Europe, and you're very right, people have children depending upon their level of education, and even with that, when they think they can afford it. And with this recession, we have seen a problem of infertility and lack of reproductivity. We're seeing fertility rates in Europe and even in the United States that are bordering on not being able to actually make enough babies to keep the society rolling along. How do you find a means by which to improve the economics of a country, which is, I think, what you're saying? Before we can actually teach reproductive health, we have to have some kind of a stable economic structure where people have the opportunity to go in education, to get an education. The school has to be built for them to go there. Someone has to first invest in the country so that people who do want to avail themselves of these opportunities are able to do so. So are you suggesting that the best way to do that is through government or through the private sector? How do we make that initial venture, that initial investment in a country to stimulate the whole process. Without that happening and without it continuing, you actually, you can't continue the process. And indeed, you need families that have enough money to secure themselves that they can afford to have children, where they're making choices about having children, and those children would then have choices for themselves as opposed to being born in a family of 15 where choices are so minimal.
Dr. Marcy, you make a very critical point. I think that solutions do exist. They can be both driven by public sector or through public-private partnerships. There are some examples of that. But the importance that I believe exists in developing countries today is that the leadership and the political commitment to make education a priority and provide opportunities, especially for young women and girls, through schooling is extremely important. Not just relying on the private sector and on the public sector. There's a lot of young girls and women that are going to be the mothers of the future, that will be better mothers, that will be better leaders in their community if they have some level of education. So that political commitment, I think, needs to come from the top and open the doors and make an enabling environment so both parents and the help from the private sector could come in order to achieve those. What happens, Dr. Marcy, is that when women have those opportunities, they tend to have fewer children. And those fewer children would then lead to them be able to have more resources, be able to accumulate more resources, and at the individual level increase the wealth, which then leads to increasing the wealth of their communities and the wealth of the country itself. So if we look at countries that have extremely high fertility, with a lot of exceptions, a lot of them have anywhere between 50 to 60% of their population living below the poverty line established by the World Bank at less than $2 a day. So you don't find that necessarily in countries that have achieved a reduced sort of a number of children, where women are having 2 children, 3 children on average. So there is a relation there between family size, ability for the poor countries to reach development, and the sizes of the families.
I think that one of the things you're saying also is there has to be a culture of optimism. People need to feel that their life is worthwhile, that they want to have children and bring them into a world where their life is worthwhile. And what you're also talking about is a world where people have the rights of self-determination, the rights to make decisions for themselves. Now, this is a politically hot question, but I'm going to ask you it anyway, because I think that people here in the United States are interested. We have recently found a lot of our culture actually going in the opposite direction, a direction of dependency, a direction of government dependence. We know about how many food stamps, we know how many people are starting to depend upon the government. And in some populations, particularly in even the newly graduated students who would graduate even from UC Berkeley, where jobs cannot be found, where we have a culture of despondency, a culture of despair. How do we change that in our own country, which is not a third world country, where it is a cultural issue, where we have to again invigorate the populace again to their personal rights of self-determination, so that they take back their own lives and not give them over to a life of dependency, the government or their parents or something like that. Do you have any comments about that?
Well, yes, I have comments for here, comments for, I think that they're applicable to any country, including where I was born, where I come from. The point you're making is extremely important, and that can be reached through education. Now, policies to encourage higher education are very important, but the market needs to be able to absorb that workforce that comes out of school, and that also includes public-private partnerships, economic development that comes from it, and opportunities for young people to join the workforce that basically will stand for the policies the effective policies to do that. Otherwise, it might not work here, but it doesn't necessarily work in any other country. So I think that those policies have to be in place in order for countries to develop, continue to develop, and people depend on themselves based on their level of education and the economic opportunities that are given to them.
So basically what you're saying is that our educational opportunities, and I agree with you, need to be such that when people graduate, either from whatever level they graduate, whether it's high school or college, they have to have a skill, a means to make a living. Education really has a goal, and that means I can take care of myself, whatever that skill is. And I think that one of the things that you're saying, if I'm correct, is that by engaging the private sector with the public sector, we could actually better have a meeting, an integration of specifically those skill level jobs. So asking a company, for instance, to invest in a college and making sure that their students are educated so that they can accept jobs at that level, whatever it be, engineer or whatever that level is, even in local communities. We're not seeing very much of that in the United States, but that's the kind of thing I think I'm hearing you say that we need to take to other countries. Businesses need to invest in a community, need to invest in the education of the community, need to make sure that that is engaged so that there's a meeting of the minds, so that when they go there with their manufacturing or whatever their service, whatever they're selling, that they're able to find the people to fill those jobs and fill more jobs and fill more jobs so that there's an economic community. Is that what I'm hearing you say?
I actually have an answer for this one, Dr. Marcy.
Sure.
Here at the School of Public Health, there are a few professors that study the epidemiology of hope, and they found that like people who have hope and people who have been shown that there can be a future different than what they have can go farther, and they have a lot more drive, and they live healthier lives, and their children live healthier lives. So definitely there needs to be a situation set up, or there needs to be investment into showing people that there can be a better life than they're living today, so that they can build a better tomorrow for themselves.
So
I think that's extremely important, not just here but around the world, so that young people, so when they go to school, they know, or they can have certain expectations about what the market is in terms of job opportunities, so that they can do the best that they can in school and be absorbed by the workforce, and therefore be sort of a self-sufficient. So even in communities in very rural sort of Africa, sub-Saharan Africa, where I work, where it used to be that maybe education wasn't as valued as in developed nations, because they couldn't see what good would bring to send a young girl to 4 years of education, because she would come home and still didn't know how to read and write, still couldn't be able to read for her mother or her father what was in the newspaper or a billboard by the side of the road. So those are the problems that then discourage parents from sending. Now, what the private sector and public-private partnerships have done is improve that quality of education that exists and give parents hope that exactly when they send their children to school, they will be able to provide later in life for themselves and for the parents themselves, which is extremely important in the African context.
So what we're both talking about is a culture of optimism, a culture of self-determination and opportunity, which is what we need to impose, inflict, or maybe ignite the nations of the world with. And maybe that's a place where people can volunteer, where Americans can go to these countries and tell them their story, your story, where they came from the poor, they were able to get a good education and show them the opportunities, because I think that is part of what we can do, not necessarily with business, but in the private sector, private citizens can go and engage these communities with missions and just visit them and show them what the opportunities are, because many of these people have never even envisioned what the world could be if they had an education. They don't have access to the internet, and books are something that they would love to have if they had them, and just even communicating with them on a direct level and going to visit them. Are you seeing that happening much? I think probably in Africa, people are starting to do that now. Do you see that? I know many of my friends and many of my doctor friends have done missions and gone to these countries, and I think it's not just that they're building wells for water, they're helping them, they're encouraging them to make good choices for themselves, and showing them what the outside world could offer them.
And fortunately, internet access is going up globally, and the drivers of having internet access, seeing what there is available out there, is going to drive society forward and give people more access to more information, and more access to more opportunities worldwide. And that could be a driver for equalization across the continents.
Now, about Angola, going back to Angola, can you tell us of a specific circumstance in Angola, of a specific business, a community, where you were able to inflict this wonderful culture of optimism, a business that was willing to invest, and where you've seen some active change and growth in education and in reproductive health?
Yes, Dr. Marcy, when I finished medical school in Angola, I was sent to a community at the time of about, as the only doctor, a young doctor, junior doctor as we call it, for about 200, in a catchment area of 200 population. And most of the population that I was supposed to serve had the traditional birth attendants, they had their traditional healers, and their traditional way of understanding and dealing with disease. So back to reproductive health was by identifying those traditional healers and traditional birth attendants working in reproductive health. That I was able to study with them, understand their beliefs, be able to basically change or substitute some of their harmful practices, and let them know that the next generation, their children and their grandchildren, would go to school, come back to help their communities, and be somebody, do something like I was doing, helping women deliver their babies, helping immunize children, helping make decisions about clean water, disposal of garbage, and all of the things that make communities safer and healthier. And they did understand that very, very well, and they started even like a fund where through savings they will put money in that fund to be able to send the girls to secondary and later school, where they could get probably not dreaming about going to medical school, because as you can imagine in Angola, a very small percentage of the population will go to college, and of those even a tinier percent will go to medical school. But at least as nurses and as midwives or assistant midwives, that the country only requires that you have a basic 6 years of education, will be really important step and they will making those steps in these communities so that they can then go back and help their communities with Western medicine, but also be able to understand and integrate their culture and the traditional practices.
And in Angola, or in other countries that you've experienced, how has the religious culture and the general culture helped or hindered with family planning programs so that you could move this project forward? I'm sure that all countries have their own cultural and religious norms, and that may help or hinder. Can you give us some examples of how we can make that work better?
Yes, they do. And you know, Dr. Marcy, that the different denominations of religions have different sort of takes on family planning. So what we do in the communities and the programs is really understand what is the composition, what is the sort of the religious denomination at the time, and work with religious institutions. And our entry point is basically make understand the local religious leaders and the communities that they serve the benefits of family planning. And one of the greatest benefits that everybody needs to understand, but even religious leaders don't dispute, is the value to prevent maternal deaths and child deaths. So what family planning can do is that by allowing women to space their pregnancies, will give them more time and increases the survival of the previous baby and increases their own survival as they go into the next cycle. So that has been my success in demonstrating the importance of the survival of the mothers and their children with family planning and the importance that the family planning can have.
And do you find that because people have such a trust usually in their religion, whatever that may be, the religious leaders are key to helping you advance the culture, to show the trust, to get people engaged? Do you find that that is another means by which we can inject this culture of optimism literally through their religious culture? Do you find the religious leaders are willing to work with you and help you in that regard? I mean, it would seem to me that that would be a door of entry, especially a door of entry and trust when someone from the outside is coming in.
No, I have to say, Dr. Marcy, that I've been quite blessed when it comes to working in the communities, regardless of their religious affiliation. After the explanations and understanding, I think that the religion that it cannot provide services is the Catholic religion. A lot of these communities where I work, the religious affiliated health facilities provide a significant amount of primary health care in these communities. But even in those circumstances, what we were able to negotiate is, okay, so they cannot provide family planning per se in the facilities where, for example, after delivery, where a woman comes to deliver in a Catholic missionary hospital. So, but they can talk about the importance of the methods, they can talk about the importance of the spacing, and we will create a parallel system as a safety net in the community so these women would have access through a different health center and health post or through a community health worker that will visit her in her home. So in this way, we're not really colliding with the principles of the religion, but we are basically understanding the importance of family planning for public health benefits.
Fabulous. Now, one last question. Talk to our viewers. Tell them what you want them to know, what they can do to help advance this opportunity. And I say that with respect to other countries in our own country as well, where I think some parts of the United States, unfortunately, are as poor and as depressed as many developing countries in the world. How do we inject that optimism? What would you like our readers to do? What can they do when they watch this video? What should they do? Where should they engage? Who should they call? What interest should they take? Should they notify you? Tell us how we can make the world more aware of this and make it happen. Obviously, that's what you want to do.
Right. Well, Dr. Marcy, as I tell all the time and tell to my students, when it comes to family planning as an intervention to improve maternal child health, anyone can help. Any individual, by allowing people that they know to access information. Knowledge is power. So knowing what to do, when to do it, and where to get the services are extremely important. And sometimes we might not even know what is happening to our neighbors, what is happening to somebody that we met during a trip, when we visited. So it is important to, as much as possible, spread the information. You can also go the next step by being an advocate for those types of services. And there is many organizations that can be found that work both in the U.S. and in developing countries to increase access to family planning services. And any individual can either provide their services or provide resources if they are willing to do so. But most importantly, create the awareness is already a very important first step, so that everyone knows the importance of family planning.
Wonderful. Well, I can't thank you enough for being a part of the Sylvia Global Media Network. It's been an absolute pleasure. You've encouraged me. And quite frankly, if you don't mind, I'll just take your message to the next level. Because I think this message was about invigorating the world. To know their rights of self-determination come with education, with knowing what's available, what they can do for themselves, how they can own their own lives, and therefore make their life, their children's life, and hopefully their grandchildren's life better, as well as the people around them. This is a message where optimism and personal involvement in your own life and in your community can make it a better world for all of us. And I think that's the ultimate message that we as doctors need to engage. Educate our patients about what their opportunities are, give them choices, but once they have the education, they usually make pretty good choices. It's that lack of education and that lack of access that lead them to despondency and despair. We need to eliminate that by educating our populace about what their choices are, and I think that this is a wonderful window on that world, and I can't thank you enough for doing what you do, for engaging me today, and hopefully we'll get to know each other better on an even grander scale. And thank you again to our audience, and if you have any questions, feel free to email me at marcy@choicecare.md, or I'll get in touch with Dr. Prata, and we'll see what we can do to make this world a better place. You deserve it, we deserve it, our children deserve it. Thank you very much. Have a good day.